Hi everyone, my name's Tanya Khan. I'm an aesthetic nurse practitioner here at TMK Aesthetics. I thought I'd do a little video giving you some information about one of the very popular treatments we offer here at the clinic called dermal fillers. In the aesthetic world of medicine, dermal fillers is one of the most important tools in rejuvenating the aging face. As we get older, we all start to lose the collagen and elastin fibres in our skin. We start to get fat pad loss and our bone starts to resorb. So we end up with a face with a little bit of a hollowness in our faces and slightly sagging skin. And thankfully, dermal fillers gives us a choice now to try and restore that volume loss. So what are dermal fillers? Dermal fillers come in lots of different types and forms and brands. They're semi-permanent and they're permanent, which we don't use here at the clinic at TMK due to the high risk nature of the reactions. So we just prefer not to for that reason. So we stick to temporary fillers here, and they can last anything from 6 months and some of the other ranges right up to 2 years. The main ones we use are hyaluronic acid fillers. Hyaluronic acid is actually something that occurs very naturally in our body, so they're relatively safe for most people to have. And due to the fact that they are composed of hyaluronic acid, we can use a special enzyme to dissolve the filler if we had to, if it was a complication or someone didn't like the treatment. So that's very good to have that option. Now, in terms of the brands of fillers, you may or may not have heard, but the main ones were going to be Juvederm, Restylane, Teoxane, Belotero, but they're actually quite a lot more than that. But the ones I named would be the main ones that we would use here at TMK Aesthetics. So just to give you a rough idea of what a syringe looks like, they come in 1 ml, and they look like this. So you can see they're clear. And if I was to inject that out onto my hand, you would see that it's actually quite soft as well and very malleable, which is important because when we're putting it into the face and the face is moving and you're smiling and talking and chewing, then obviously that flows and moves very easily with the body and you're the face and you don't know that it's there. So really the most important thing to know is that it is such a small amount. I mean, a lot of people are very afraid of fillers for different reasons. They think they won't look like themselves or they're going to have a big puffy face. A 1 ml syringe really is the equivalent of 1/5 of a teaspoon. A teaspoon is 5 ml and this is 1 ml. If you think about giving your child 5 ml of paracetamol, it's 1/5 of that. It really isn't a lot. And quite often when you're coming in for a treatment, unless we're addressing a very small area like the lips or a bit in the chin or top up, 1 syringe might not be enough. You might have to have a couple or might have to have your treatments done over a couple of sittings depending on what it is that we're trying to address. But fillers are really great and they can be used in the temples, in the eyebrows for lift. They can be used under the eyes to try and reduce the hollowness. They can be used in the mid-cheek for the projection. And we can use it on our cheekbones to give us some projection laterally. We can actually have it in our jaw lines. Creates a little bit of a lifting effect and gives some definition. In the lips for some volume. And the chin. And we can actually have different types of fillers. We can have very thick fillers to really try and give that good amount of volumizing, and especially if we're trying to create a lifting effect for the more saggy type skin. Or we can have really light ones for really, really fine lines here, or for just a little bit in the lips just to give more of a hydrated look. It's really important that whoever you go to have your injectables with, that they are fully trained in aesthetic medicines and injectables and they have full knowledge of facial anatomy. It's so important. If you run into any problems at all, and there are complications, but we won't talk about them in this video, that they know how to handle that. So that is very important. But basically on the whole, dermal fillers are amazing and in the right hands, nothing to worry about. So if you would like to give me a wee call, or if you'd like to book and call in for consultation to see if dermal filler is something that you would be interested in, or if it could offer any kind of result in rejuvenating your face, then give me a call or text or private message. Okay, thanks.